For agenda approval. Thank you, Aldo and Fabio. All in favor? Opposed, if any, that's carried. Thank you. Any conflict of interest on the agenda as presented to you? Okay, I see no declaration, so we'll move on to update 4.1, the COVID-19 update. Dr. Nazatiri, please.
Board Chair, Mr. McNamara, members of the Board of Health, my colleagues in the Public Health Service, thank you for allowing me to speak today. My first point I'd like to share is that the pandemic is not over. We are in a quiescent phase of the pandemic. When we look at the metrics that we're following, some of the metrics suggest increased disease activity and some suggest decreased disease activity. But overall, I'd say week by week, there's not much of a change. Some of the metrics which show some signals of increase include the number of cases and also the percentage positivity. Some of the signals that suggest a decline in disease activity include wastewater data and the number of people currently hospitalized. But taken together, I think that we would consider this a more quiescent phase of the pandemic. We've had 4 deaths in the last week. We had, I believe, 4 deaths the week before and 5 deaths the week before that. And so if death is in itself a metric of burden of disease, there's still some significant burden of disease. I think one of the things moving forward is that we have to think of what metrics we're going to use moving forward to assess the burden of disease. The epidemiology team has articulated certain indices, and they should refine those, and over a period of time, I'm hopeful we can share that with the Board of Health and with all of us, the community overall on a regular basis. That includes things like death, hospitalization rate, wastewater data, number of cases, percentage positivity. The one challenge I'd say is that each of these individual metrics have limitations, and we should be cautious about that. If I could share, from my perspective, no matter where we are in the phase of the pandemic, I think we have to think of all the activities that the Public Health Service used to do, which were set aside or reduced or curtailed during the pandemic. And I think most people in disaster planning would agree that the recovery, if we can call it a recovery, is more challenging than dealing with the underlying disaster itself. And so I would prefer to characterize this as more of normalization. As we move through normalization, I think that we have to consider what activities we want to restart as a public health service, and also what activities we want to discard or curtail. I don't believe the public health service should be focused on doing everything that it did in the past. And I think this gives us an opportunity to perhaps reevaluate what our priorities moving forward. Today is an important day because it is the World Tuberculosis Day, or the World TB Day. And why that might be important is to recognize that worldwide, 1.5 million people died of TB last year. 10 million people got sick from TB. And TB cases and TB is a burden to the public health in the Windsor-Essex Health District. There have been people in recent times who have died of tuberculosis in the Windsor-Essex Health District. Last year, there were approximately 10 people who had clinically apparent or clinically symptomatic tuberculosis. And there were about approximately 150 people who had what we can label latent tuberculosis, where they were exposed and infected to tuberculosis, but they currently aren't symptomatic. The reason that's important is that the Public Health Service works very diligently to screen and identify people who might be at risk for tuberculosis, and also helps facilitate the treatment of people who have tuberculosis. It's not always well understood that a number of tuberculosis drugs are dispensed via the Public Health Service in Windsor-Essex. So our core message would be that tuberculosis remains a challenge in the health district. It remains a challenge worldwide, and raising our level of attention and awareness of this disease is important. To that extent, the Public Health Service in Windsor-Essex has lit up its building today in a red color, and we had some media messaging today, and hopefully that will be carried as earned media, where we are emphasizing and sharing the importance of tuberculosis screening and management. I wanted to share one item, two additional items. One is the latest burden of vaccination, or the latest data for vaccination. We have 432,000 people in the health district. I'm looking at my notes here, of which approximately 191,000 have all 3 doses of the vaccine. So those 191,000 people have the maximum protection against COVID. Another 150,000 people have 2 doses of vaccine, and 76,000 people have no vaccine or have no vaccine. Of that, 56,000 are adults, and the remaining 20,000 or so are children under 5. So when we look at the people that are maximally protected against COVID in the health district, it's about half the community. Of the people who have some level of vaccination, they are individuals who are now with waning immunity, meaning this, that the vast majority of people who got their second injections got them late last year, August, September, October, and the vaccinations wane, or the effectiveness of the vaccinations wane with time. That's why it's recommended for most people to get a booster. So as we move forward into these next few months, we are in a quiescent phase, but we also have a risk set, a community risk set that is vulnerable. We know from the latest data today that the epidemiology team shared, and we share this publicly, is the disproportionate number of deaths of COVID are among the unvaccinated. In fact, if someone is unvaccinated, they are 4 times as likely, approximately 4 times as likely to die of COVID than an unvaccinated person. Moving forward, another core message is beyond vaccination, people are at high risk for suffering from complications of COVID. There are at least one effective medical treatment, and that is available at the assessment centers. Now, this is reserved for people who are at high risk for COVID, substantively, people that are immunocompromised or unvaccinated, people beyond a certain age threshold. But I think that we'll have to continue with our messaging to say that there are treatments for people that are at the highest risks for suffering from COVID. Finally, I'd like to conclude by saying that we've been relatively unaffected by influenza, but this past week, the first recognized influenza case, the first case of influenza was recognized in the Windsor-Essex Health District. Now, we're at the end of the flu season, or towards the end of the flu season, but this may be just a sporadic case, but this could also signal potentially additional cases of the flu that will also be an additional burden of disease. I would still encourage people who are eligible for the flu vaccine to get vaccinated, and I think that that would be one more incremental step in advancing the health of the community. I appreciate the opportunity to share my perspective and the perspective of the Public Health Service, and I'd be happy to answer any questions.
Thank you very much, Dr. Nazatiri, for your report. Any questions or comments directed at our MOH? Yes, Judy.
Hi, to the doctor through the chair. Thank you. Just wondering, because we're coming out of wearing masks, etc., a lot. It seems like in the last week or so, there's a lot of people getting sick with non-COVID or they're not sure things. Do we expect actually influenza and some of these other diseases who've kind of been held at bay, the common cold, because of the mask, do we expect to see an uptake in all of these over the next few months as well, or that's just everybody I know?
Yeah, I think it's fair to be cautious, and I concur with your perspective. I think it's fair to be cautious because a lot of respiratory transmittable diseases were suppressed because people were wearing masks. maintaining social or physical distancing, minimizing large gatherings. And as we move forward with public health measure relaxations, it would be anticipated, and it's only reasonable to conclude that there would be greater number of communicable diseases that are respiratory communicable diseases, including the common cold and influenza. It's something that the Public Health Service is monitoring, and but that remains a concern moving forward.
Thank you.
All right, thank you. Any further questions or comments to our MOH? Okay, I don't see any. And then if I could have a motion to receive the verbal report. Thank you, Ed and Reno. All in favor? Opposed, if any? That is carried. Thank you very much, Dr. Nezateri. Okay, 5, the approval of the minutes of the regular board meeting of February 17, 2022. That's item 5.1. Moved by Reno and supported by Aldo. Any errors or omission on those minutes? Having heard none, all in favor? Opposed, that is carried. Thank you. Move on to 6.0, business arising. 6.1, the annual service plan. I believe Lori and Nicole, what am I thinking, Nancy? Have been working with us for 100 years, but anyway, sorry about that, Nicole. Too many meetings today.
Yeah, so I'll just get started and then turn it over to Lori. So I'll just note that the annual service plan is noted as business arising, but also is under 7.2 for resolution recommendation reports. So through you, we can hopefully just deal with them both at this time. As our board is aware, we approved the budget. We had an amendment to that budget at our last board meeting, and our official annual service plan, which we submit to the ministry, is due every year. There were some adjustments, so we did make our submission at the beginning of this month. And Lori will walk you through just a few additions. We always have the opportunity for one-time business cases as part of our annual service plan, and these are put forward as 100% requests to the ministry. And every health unit's allowed a certain amount, and some are prescribed, and then some are opened for the health unit to determine based on our needs, items that we might be able to request within certain parameters. So. And I probably will get the number wrong again, but I think we have 8 in total. So, we'll bring those forward for your review, and I'll turn it over to Lori and she can walk through those details.
All right, thank you.
So I'm just going to quickly share my screen. Just focusing in on the mid part of the report, which details the business cases that were put forward to the ministry. As you all recall, we put forward in our November presentation to yourselves, and again in January, we put forward costs associated with the COVID vaccine extraordinary, the COVID vaccine program. The totality of the costs submitted in an annual service plan that exceeded our mandatory budget amounted to $5,348,120 for activities associated with recovery. And as you can see, I'll just scroll down briefly. These are activities that support community needs assessment, review surveillance data to identify priorities within our community, catch-up clinics associated with immunization efforts to support ISPA, catching up on certain screenings such as oral health and vision screening. The totality of that business case is $2,671,524. From a capital perspective, we did put forward a request for certain capital dollars to support the consumption and treatment site, certain setup costs associated with that, and as well costs associated with furniture fit out for the new Windsor office. And I'll just scroll down to that specifics in the report. The totality of the dollars associated with the consumption and treatment site were $250,302. and the totality of the dollars associated with the support of the furniture fit out for the future Windsor site of $619,027. Additionally, we put forward CTS operating costs. We attempted to quantify an estimate of the potential impact of operating costs for the consumption and treatment site for the 2022 April 1 timeframe to March 31st of 2023. This includes things such as rent, property taxes, certain supplies such as needles and syringes, as well as salaries and benefits associated with the individuals that would be supporting the services there. The next business case we put forward is associated with Vector-Borne Diseases. The totality of that business case, which supports salaries and benefits as well as mileage and communication and awareness costs, is $128,596. And lastly, we put forward a business case for public health inspector practicum students. On an annual basis, there is a certain number of students that are approved by the Ministry of Health. They provide an allotment of $10,000 per student to support various activities within the environmental health department. And again, so the totality of all the business cases that we put forward to the Ministry of Health is $10,825,734. As a reminder to our Board of Health, and in particular, anything associated with COVID and COVID vaccination, we do provide quarterly reporting to the ministry, and that will start again for Q2 of 2022 and quarterly over the past 2 years. And we understand that that'll be the case in 2022 as well. They will be reviewing our expenditures, and in the event that there are expenditures that exceed our budget proposal put through, they will review those with us, and you know, there could be adjustments to our funding approvals that happen thereafter. So I'm just going to stop sharing my screen, so in the event that there are any questions, I can actually see everyone. Okay. So if anyone has any questions, so that the request would be to approve the recommendations that were put forward to the Ministry of Health as required by the Ministry of Health as a function of our annual service plan.
Okay, thank you very much, Laurie, for the presentation. Any questions or comments? Okay, then a motion and to adopt the report. Ed and Judy, all in favor? Opposed, if any, that is carried. 6.2, the Alpha Winter Symposium Conference update.
Just a note that the conference did occur a few weeks ago. Several, myself attended, Dr. Nasathuri, as well as I think Robert and Judy were both able to attend. And so, you know, it was a good opportunity just to hear some of the visioning for public health. In particular, Dr. Moore provided some updates, as well as Dr. Tam, and just some thoughts that linked to her 2021 State of Public Health report. It was nice to hear some of the highlights, I think, around what at least Ontario believes are important items that reflected what we as a local public health unit also believe are important in the face of recovery, and certainly a lot of emphasis on substance use and mental health, as well as obviously picking up some of the backlog of, as we've talked about, our childhood immunizations and getting back to some of our healthy growth and development programs. So it was, you know, nice, at least for me, to hear those items that we know are priorities here reflected back by our leaders across the province. Just thought if Judy or Robert have anything that they wanted to share, and but just wanted to share a little note on that. And as well, we'll bring forward next month, obviously the AGM is coming up, so there'll be an opportunity to discuss the annual general meeting for ALPA. And I guess just if anyone has any questions.
Oh, I see no hands, so if I can have a motion to receive that update. Judy and Ed, all in favor? Opposed, that's carried, thank you. We'll move on to the consent agenda, 7.1 through to 7.1 to 7.16. A motion to receive the consent agenda. Reno and Joe. Reno, I got
Just
this bar right in
sorry.
front of you, and I couldn't see your.
Sorry, I just have a quick question. I didn't, and I apologize, I didn't get it at JBEC, but the committee that struck, or the item, the Ontario Active School Travel Grant, in the update at the end, it just talks about next steps, and I'm just wondering if any of the information will be shared with the municipalities as well. I'm assuming that sort of infrastructure or lack of infrastructure or improvements to infrastructure for cycling or walking facilities would obviously be something that might be identified. Is there a plan to send either a report or some sort of communication as far as a recap of what happened during the grant, and maybe identifying any gaps in infrastructure to the host municipality, depending on where the pilot schools were?
So Nicole or Christy?
Eric, actually, who
Oh, Eric.
think. Eric, are you there? Looks
Yes,
like he was
I
off
am
mute.
here. I am here, yes. Thanks for the question, Councillor. The municipalities are represented on the steering committee of the grant. However, the walkability and bikeability assessments would have been targeted specifically to the 6 pilot schools at this point in time. Now, that's not to say that there aren't generic learnings around the environment around that school that couldn't be shared with the municipality. So I'll bring that suggestion back to the committee, and I'll just figure out the best way to translate that information up to the city and county.
Just on a sidebar to that, yesterday we had a very first introduction to the new official plan development for the county. I know Tracy was there and participated in it, and it was identified even there that the stakeholders, and in particular for exactly what you're saying, Reno, we're looking at putting that or entrenching that into the new official plan of the county, using the health unit as an opportunity for the county to develop their OP with a quality of life lens and environmental lens. So, this is, I think it's going to, spread into, into more of our official plans as we move forward, which I think is a good thing. Okay. So it's been moved and supported. Is there anything, and I'll reach out to obviously the authors of a lot of these reports, is there any highlight that they want to bring forward at this stage in the report? Okay, pretty quiet. So on the motion, all in favor? Opposed, if any? That is carried. Thank you. We have no resolutions to deal with this evening, members of the board. So we'll go to new business, 8.1, the Board of Health, paperless meetings. And Nicole, I'll let you lead this report.
Okay, so it'll be very short and sweet, but as if, again, we don't have anything else to do, we thought we'd also look at paperless meetings for our board. It is something we've talked about for quite some time, and certainly just, especially during the pandemic for all of us working more remotely, and we're certainly looking at how we transfer information safely and securely, and and to be able to be more efficient and ensure that our board has everything they need at their fingertips. So this is more just awareness that we're our guinea pigs will be the board executive, so they are aware of that. We'll be starting with them, but at some point we'll be moving to having tablets for all of our board members. We will provide some training for you, obviously, on that, and then a secure document holder on that tablet, where you'll, instead of receiving, packages through Leanne, you'll receive an email from Leanne telling you, our board package is ready, and it'll just be there right available for you. And you should be able to flip through it just as you would a paper copy or binder. You'll just be flipping through it electronically. So that is something that we're working on, and we'll be rolling out to the executive committee. They can tell us any troubles that we have, so we can refine our training or approaches, and then eventually we'll roll it out to all of you. So if you have any questions in the interim, let me know. But for those of you who aren't super tech savvy, it's pretty simple, and we'll make sure that we provide the right support and training for you as well.
No, I think so. I think it's great. I think for many of us, we've been our meetings, and I know I think the city of Windsor as well, we're paperless in our meetings, the county as well. And I've got this beautiful screen right next here that I could put stuff on. So looking forward to it, and I think it's high time.
And I'll just add that it's part of revamping some of our other items as well. We'll be reviewing the board orientation, and all of those documents that are important for you as a board will, outside of just the meeting agendas and packages, will also be on those iPads. So everything you would need will be at your fingertips and easy to find. So that's the intent.
Excellent. Ed.
Yeah, thank you. Since I am maybe computer illiterate in a way, but I think I know enough. If we go paperless, does it mean we need one computer for the Zoom and another computer for the agenda? So we need like two computers basically? And I see Judy is shaking her head. Yes or no?
Kind of, yeah. So Ed, you're obviously on the Teams meeting now. So instead of printing a package, if you do that, you'll have a tablet that you can hold like a book in front of you, and it just means instead of us printing it, you won't have to print it. It'll be right on your tablet, and you can follow along. But you'll still, need your computer. As long as we're electronic for our meetings, you'll need your computer, obviously, to see us. At some point in time, I'm sure we'll be back in in-person meetings, and then you'll just bring your tablet with you to the meeting, and you won't get the printed packages around the table like we used to have. Does that clarify it?
I think that makes a lot of sense. Actually, it's the point we call it a tablet or a computer. So you need another computer in a way to be able to put the agenda on it and scroll through.
Yeah, for now. Yeah, I mean, technically you could do both on the tablet, but then you wouldn't be able to see everybody while you were flipping through the but you could if you needed to, you could have them both, but yeah.
Thanks, Nicole.
Yes, you're welcome.
Okay. Any further questions or comments? Okay, so there's a motion to receive the Board of Health paperless meetings report. Tracy and Fabio. All in favor? Opposed, if any? That is carried. Thank you. All right, we've got some correspondence. It's a letter to the CMOH, Dr. Karen Moore, work deployment measures for Board of Health. And we're certainly looking, I believe, for support. Move, Joe, support, Reno. Questions or comments? Hearing none, all in favor? Opposed, if any? That's carried. Thank you. 9.2, Sudbury District Public Health. It's a letter to Alpha President Dr. Paul Leotis, and it's health and racial equity, denouncing acts and symbols of hate. So we're looking for support there as well. Judy, Ed, move support, and any questions or comments? Hearing none, all in favor? Opposed, if any? That is also carried. So this leads us, members of the board, to the committee of the whole, a closed session in accordance with section 239 of the municipal law. If I could have a motion to move, oh, sorry.
Just one, it's a quick item, but we skipped 8.2.
Did we?
I think it might have been purposeful. It's bylaws and not very exciting, but
You know what? I put a check mark on that when I shouldn't have. And so thank you for reminding me. So let's go back to 8.2 and not to dismiss the importance of bylaws. So I'll turn that over to you, Nicole. Thank you.
Okay, so I will make it very painless. And I did have a little presentation about bylaws, but I won't go through it because you'll hear more about it in the future. So for those of you who are new to board, well, you would have read them and you will hopefully maybe not so fondly remember they are 170 pages. So and the bylaws do, and about 70 of those 170 pages are footnotes. So we are just going through the process of revising and reviewing. That's something that we need to do every few years. And just given the pandemic, it slowed us down a little bit. So they're definitely quite out of date. In particular, some areas around changes in legislation that will need to be updated. So we did bring to the board executive and just reviewing with you with the board. We're looking, again, this matches with our paperless, going paperless and trying to make things a little bit more simple. We're also updating our board landing page on our website so that, you know, everything can be linked there and it's easy, you know, for the public to access as well. In order to do that, we really want to realign the bylaws. So as we review them, we're going to be breaking them into sections. Right now, they're just one big consolidated document. And which we would need to review as one big consolidated document. So we'll be breaking them down into sections around governance, finance, and those associated with HR as well. There's not a clear delineation in our bylaws currently, you know, which items are really more should be a board policy and what part is the actual bylaw. So we'll, as we review it, we'll be breaking it out so it's simpler and they can be reviewed in pieces. So starting next board meeting, we'll be bringing those forward for your review. Obviously, we'll make recommendations about the things that need to be updated and just, you know, wanted to bring that fulsomely forward to let you know that will be undertaken and we'll be doing I'll be doing my best to make it as painless as possible. I know it's been described as a bit of an arduous process. I know it was when we first went through them, but we'll be breaking it up and trying to make it as simple as process as possible. And our hope is that through April to June board meetings, we'll have them reviewed and completed before we break as a board for the summer.
Okay, thank you, Nicole. Any questions or comments? All right, motion to receive the verbal report from, okay, and moved by Reno and supported by Ed. All in favor? Opposed, if any, that is carried. Now we'll go to 10.0, Committee of the Whole, under Section 239 Municipal Act. Motion to move in camera. Judy and Reno, all in favor? Opposed, that is carried. So I'll leave it to you, Leanne, to let us know when we're